Hello, Medicare Dave here from the Senior Healthcare Team, and I wanted to make a quick video sharing with you some exciting news that affects Medicare Part D prescription drug plans and the pricing of specific drugs, specifically insulin and diabetes medications. In late May, CMS, the Center for Medicare and Medicaid Services, announced that over 1,750 standalone Medicare Part D prescription drug plans have applied to offer lower insulin cost as part of what's called the Part D Senior Savings Model for the year 2021. Across the nation, these participating enhanced Part D drug plans will provide Medicare beneficiaries access to a broad set of insulins at a maximum of $35 copay for a month's supply, beginning in the year 2021. Anybody that's diabetic that has been on insulins knows that the cost and the copays for these drugs can be considerably higher than $35 a month. So this is very good news. Currently, Part D sponsors may offer prescription drug plans that provide lower cost sharing in the coverage gap. However, when they do, the Part D drug company accrues costs that the pharmaceutical companies normally would pay, and then these costs are passed on to the beneficiaries in the form of higher premiums. So this new model directly addresses this disincentive by doing two things. First of all, it allows the manufacturers to continue paying their full discounts for the products, even when that plan offers lower cost sharing. And number two, it requires the Part D drug plan sponsors to lower cost sharing to no more than $35 a month. $35 a month for a 1 month supply for a broad set of insulins. So this is really exciting news. In order to apply for these new drug plans, right, because the current Part D drug plan that you're enrolled in, you're married to through the end of this year, which is 2020. But you can apply for the new drug plans for 2021 during the annual election period, which runs from October 15th through December 7th. Probably at the beginning of October, we'll be able to see these new plans and the pricing on the Medicare.gov website. A couple of other interesting notes. This Part D senior saving model has taken some additional actions to address the needs of beneficiaries with diabetes. Number one, they're providing continuous coverage for therapeutic continuous glucose monitors for patients who synchronize their insulin devices with their smartphones. It also implements statutory requirements for Part D drug plan sponsors to allow enrollees to obtain prescription refills for up to a 3-month supply in most instances. Previously, sometimes it was more difficult. There was more red tape and sign-offs required to get a 3-month supply of certain medications. So they are easing the restrictions on that to make it a lot more easy. They're also providing additional flexibility to Part D drug plan sponsors to give beneficiaries more options for delivery of their medications, including diabetes supplies, through mail order and through traditional retail pharmacies. They're also going to be expanding telehealth so that people with diabetes nationwide can still maintain access to their doctor. Expanding access to therapeutic continuous glucose monitors for patients with diabetes as determined medically appropriate by practitioners. Previously, patients were required to meet certain clinical criteria to qualify for coverage for continuous glucose monitors. During the COVID shutdown, as it was more difficult for patients to get in and to sign off on that, CMS will not enforce the clinical indications for therapeutic continuous glucose monitors in an effort to give practitioners the flexibility to allow more of their diabetic patients to better monitor their glucose and adjust insulin doses from home. So this is all very good news. We are more than halfway through 2021, so these new policies will take effect in January. If you have any more questions or anything specific that you'd like to know, feel free to either leave a question or a comment in the comment section. You can always feel free to reach out to me by phone or by email. Phone number is 866-333-7430. email is dave@medicaredave.com. I wish you all the best. Stay safe and stay healthy.